Hey guys, this is Manu, physical therapist and herbalist. So today's video, I'm going to show you another technique to help mobilize the hamstrings, specifically following hamstring strains or pulls, those injuries which become chronic due to adhesions and thickening that forms around micro tears. So I've shown a couple other videos on how to do mobilization of that tissue, how to break down that scar tissue using your hands and your elbows, which is soft tissue mobilization techniques. So this is more of a self-mobilization technique where you can use a ball, a lacrosse ball, to mobilize that tissue yourself. So a chair, edge of a chair or a table will work just fine. And what we're going to do is we're going to take this and we're going to find, so let's say the strain is along the, remember your hamstrings are the muscles in the back of your thighs. So if the strain is along the muscle belly somewhere, we're going to search and find the tender spot, and you're going to put a little pressure on that and then do some stretching of that hamstring tissue. So let's say we find that spot to be right about there at the midpoint, and so all she's going to do is she's going to have her hands here on the side so she can maneuver herself back and forth and see where she's at. So yeah, move yourself up and down, and so she can find that spot. Let's say that's the spot she finds. So now she can bear some weight on that, and you can control how much weight you bring down onto that tissue by your arms. Okay, so once you put some pressure, now you can move your leg around back and forth too to figure out where the spot is, and then it's a matter of extending your leg, your knee back and forth, because that stretches that hamstrings as well as maintaining that pressure on it. So it really helps mobilize that tissue. Okay, and you might have to roll on it a little further or move back, depending on where the spot is or a couple of spots are. Okay, so and you can control the amount of pressure you're applying on it. So if she leans her body forward a bit more and brings more of the weight onto that ball, so that might apply more pressure now. And then she can work at sliding back and forth, okay? And she could even technically, you could even apply more pressure with your hand on it. But, if you're doing a self-mobilization technique, so you can work at stretching that tissue. And, you wiggle side to side, go back and forth, really work at moving in various directions to get at those adhesions and the knotted up tissue. This will be a really good way to not only help improve that mobility, but also to free up multiple layers of that tissue that are bound up. So once that tissue starts to move better, it can also help improve the overall length of that tissue. So better flexibility, and then you can start working on the strengthening part if you have less pain and less restrictions on that tissue. Okay, so your goal is here to work on improving getting rid of the sticky spots. All right. I would spend about 5-10 minutes, really, 5 minutes initially, first couple of times to search and work on that tissue. You can even maintain sustained pressure on that spot for a minute or two, like doing self-acupressure on that spot to free up the knotted tissue. If you do too much, it can get sore, so I would do it every other day initially or every 2 days till you get more comfortable with it, the mobility improves, not as sore, and then you can do it more frequently. So I hope that helps. Gives you another tool to help at self-mobilizing.